Good afternoon, everyone. Welcome to your Monday. Today we thought we'd talk a little bit about tendon type injuries, which is something that both myself and Artif have seen quite a lot of just coming out of lockdown here. So a tendon commonly gets injured when we have a mismatch between the amount of stress that's been put on that tendon and its ability for it to recover. And where's some common spots that we do see tendon type injuries, Artif?
Well, commonly there's Achilles. We see the Achilles tendon as being a major issue, particularly in sports, particularly coming back out of lockdown. The patella tendon, which is on the front of your knee there, and I commonly see the elbow tendon, or what we refer to mostly as tennis elbow.
Yeah, so a lot of tennis elbow, which can be particularly nasty and quite painful, but something that is quite fixable if we can play our cards right and get the amount of load right to get that tendon recovering in time and all happy again.
So I put a question to you. What should our viewers not do with tendon injuries?
So complete rest isn't the answer here, but at the same time we don't want to wind that tendon up unnecessarily. So still using it, but keeping it in a pain-free fashion is the best way to go about that.
The other thing is, a lot of our patients who come to see us have been rubbing their tendon, like they'll get on their elbow and they'll just give it a good massage.
Yeah.
Do we have any thoughts? Do we have any thoughts on this? Is it of any benefit? Is it actually going to make things worse?
Yeah, so it actually sensitizes the area and can make it feel worse. And I know it's natural to almost want to rub a sore area, but these tendons, funnily enough, are quite tender if we touch them when they are injured, and that's just going to wind them up. So best not to rub your elbow if it's sore.
So if we do get someone coming to us with an acute tendon problem, what are the basic things we should be doing for that?
Yeah, so looking to unload the tendon and take away those aggravating factors from whatever is causing that. Often at the elbows, it can be related to desk setup and the way we're typing and things like that, or the way we're carrying and gripping things. So let's look at that first. We also want to get some pain relief type exercises in here, and something that I like to go through is static hold type exercises, which in some studies have recently been shown to be as effective as paracetamol for pain relief. So we might as well use that to our advantage, right?
So watch that, that's coming up in our next video. So essentially for tendons, we are your load managers.
Absolutely.
So depending on what you want to get back to, whether it's sport, whether it's getting back into work, whether it's just being able to tolerate doing certain tasks, we are your load managers and we will guide you through that. However long it takes. Some tendons can be a little bit more irritable than others, and different parts of the body obviously make a difference as well.
Yeah, absolutely. But stay tuned for our next video. We'll go through some pain relief exercises and how to get these tendons all sorted and happy again.